going to be showing a quick video and demoing the QiiQ Virtual Assistant. So I'm going to go here and start the app. And you can see here we get the welcome screen. And I'll be putting in the demo user account and password and logging in. And I'll see a list of my patients in the department that I'm currently signed up for. Usually when I go into this list, the next thing I want to know is the next patient that needs to be seen. So I go into the all patients, and I'm going to sign up for this patient, Arlene Polowski. So I swipe over sideways and add them to my list. Then I go into the triage summary and pull up some triage information. And I can see the triage note that says that patient was here for right-sided abdominal pain for the past 2 days, and it's getting worse. Also loss of their appetite. So at this point, I want to go in and start a note. And I could start here by just dictating something briefly. This is a 17-year-old female coming in with 2 days of right lower quadrant abdominal pain. She has a history of cholecystitis with cholecystectomy. She states that she has a decreased sense of appetite. You can see that this picks up the medical jargon pretty well, and I'm now able to go in and put in some orders. In this patient, I'm going to place a CBC and a BMP just to start and submit those. I'm going to go back to my patient list, and I'm going to see here that there's a patient here that came in with abnormal lab results. So when I go in, I could get a brief overview of this patient's chart, their latest vital signs, their latest labs. I could also see their vital signs in order, as well as previous labs, previous encounters, radiology reports, any notes that are already started, allergies, conditions, medications, and such. I'm more interested in this patient's labs, as the patient came in with abnormal kidney function. And I could see here that the patient's creatinine is 4.99. And if I tap it, I could quickly see that this patient's trend of the creatinine over the past few years has been pretty erratic. And I could even tap on the values and quickly see what the trends were and what the values were on those specific dates. If I go back to my patient list, I have a couple of other functionality on here. As you can see, there's some icons on the right. These are indicative of notifications that include new lab results and new vitals. Since this is in a demo environment, everything is showing up as new. And there's also going to be an icon for any new notes that are pushed to the chart. So if there is a consultant, you get notified right away that there is a new note that's back. There's also a feature where I could go in and look at messages, and I could start a conversation in the context of the patient, and anybody on the care team can communicate. So for example, in this patient, I'm asking the case manager if this patient qualifies for inpatient status. That would include the case manager, the nurse, the physician's resident, and such. There's also an icon on the top right for the little bell that aggregates all my notifications in one area. So in case I miss something, I could quickly go back here and see all the notifications for any new labs, critical values, vitals, or notes. I can navigate the chart even faster using speech and natural language processing. For example, when I wanted to see the triage complaint for the patient in bed 1, I could simply ask, "Show me the triage note for the patient in room 1." So I could see that the patient is here for right-sided lower abdominal pain. Now, after seeing and talking to the patient, I could go into the note, start a note on the patient in room 1. If I wanted to place orders, I could actually specify what orders I want to order, all in one string. Order a CBC, a chemistry, and a CAT scan of the abdomen for the patient in room 1. And hit submit. The next thing I wanted to do was find out about those labs for that patient with the abnormal kidney function. I could quickly ask about another patient and trend the labs all in one question. Show me the creatinine for the past 3 years for the patient in room 11. As you can see, it filters out all the results And I could actually trend it just by tapping on one of these. That is a quick overview of what we could do with the QiiQ Assistant as it is today. And we expect more features to come down the line.